Welcome to the Dental CEO Podcast, Dentistry in the Real World, where each episode we'll interview a real-world practicing dentist and learn from their success, as well as discuss tips from masters in the industry. Thanks a lot, and stay tuned for some great content on how to build a practice you love and master your profession. Hello everyone and welcome. Today I have the pleasure of introducing my good friend and fellow online dental educator, Ziv Simon. He is a periodontist in Beverly Hills, California, and founder of the SurgicalMaster online training program. So today he's going to share with us some tips and advice to general dentists on how they can expand their skills and bring in advanced surgical procedures into their practice, which will increase their marketing ability and also increase their profit. So he is a great program. He's going to share with us what he's got going. If you're a general dentist, new dentist out there, check it out. It's a great online program, so you don't have to travel all over the country, and a great resource for new dentists. Yeah, so tell me about what you got going. I mean, I know, I think my subscribers know who you are because you're kind of participating too a little bit in our mastermind group on Facebook, but you've also kind of been communicating through posts and sharing posts, and I know you've got a great stuff that I've shared with them, but I'm excited seeing your launch because I know, one of the things I do every year is the yearly CE guide for new dentists, just so they can get efficient and quality CE. And a lot of what I know my generation, dentists 0 to 10 years out want to see is more online training, not having to go to hotel rooms and fly all over the country, but to get quality skills-based training. So, I mean, I love what you're doing. I think it's awesome. Tell me about it.
Well, the courses themselves are purely online, but it's not a type of course where you watch a video and good luck, meaning the courses are always offered with mentorship and coaching by me. So the way I set it up is that there's an online platform where doctors can log in. I call it a dedicated platform. They log in with their own name and email, and they get weekly content on the topic of the course. In this case, it's crown lengthening. And then there are live webinars and live coaching calls. And I want to make sure that everything that they learn, they can then apply and perform. And once they see some problems and they have some questions and challenges, we tackle them during the course. So it's kind of a fully immersive experience, and it doesn't really exist out there in dentistry. I mean, we have the live courses in, weekend courses, the weekend warrior courses, where you get overwhelmed and you finish the course and you go back to your practice and all your instruments stay in the drawer because you don't know where to start. But if you build your knowledge very, very gradually, make sure you understand the steps, then you get confidence and you can perform.
And all delivered over kind of online mediums. I mean, you can be
everything is online.
It can be all over the world, online, anywhere, and have a mentor and support. I mean, that's amazing, because one of the things that I know in my career learning, as you know, I've talked to you about being an advanced general dental practitioner. One of the things I preach to practicing dentist members is that you need to train yourself to be able to handle some advanced dental procedures, meaning surgery or endo or ortho. But I know personally, one of the biggest things for me is when I got out and I would go to those courses and I'd learn the background and the history, I would look around and say, well, who's going to help me now? It's like, they teach you and then they set you loose in the real world. So, I mean, that's huge to have you. So, I mean, how does that work with access to you and your coaching? I mean, is it in group coaching, or how does that?
Well, that's what makes it so interesting, because what you just said is exactly what I saw for years. And by the way, I was making the same mistakes. I was teaching courses over weekends, and doctors would call me after the course. So the way it started, I would make a video. Instead of explaining things over and over again, I would make a video and another video and another video, and that's how the whole thing started. So now that we have a dedicated course, technically the doctors that participate will have 24/7 access to me. And how does it work? We have a dedicated Facebook group that is called the Surgical Mastermind, and it's a real private group because it's open only for doctors that participate in my courses. And and there we post our courses, our cases. And if a doctor has a question, they post the case. They get my feedback. They get the feedback from other doctors on the same platform. And then in preparation for the course, I have a one-on-one session with every doctor where we sit on via Skype or Zoom, and we discuss their problems, we discuss their challenges, we go over some cases or some problems they had in the past, and then we devise a what's next strategy for them. Basically, what did they need to do next to actually apply and perform surgery in a general practice setting. So a lot of dentists, even out of school, they have some basic skills, but no surgical skills. And they're honing their restorative skills, but the potential is really in the surgery. As you know, the overhead is low, the need is there, and you already have these patients in your practice. So the way it's actually going to work out, I'm going to tackle the topic of crown lengthening through the video platform, through the online program, through mentoring one-on-one, through group coaching, which will be we call it webinar or online training. But I also have an audio program, so when you drive your car or you work out in the gym, you can listen to the audio about crown lengthening. So if you acquire the knowledge from all sorts of directions, there's a better chance that it will stick. And also, I make sure that you start screening patients and I start preparing you for performance, surgical performance.
Yeah, that's interesting, Ziv. And so just in case people aren't clear, tell me your background, because we should probably say
okay.
what credibility you have to be teaching these things, what you've done, and what your certification is, just so they know.
Great. So basically, I'm a periodontist. I graduated from the University of Toronto in 2003, and then started a practice here in Beverly Hills same year. And I've been teaching all along from the moment I graduated at USC. So I was teaching first the AEGD, the Advanced Education General Dentistry, but then I transferred to the CE department, and I've been giving continuing education courses for the past close to 14 years, all surgical courses, all weekend courses, and then started teaching also for other organizations, some of them, the American Academy for Oral Surgery, endodontic organizations, orthodontic organizations, and also different dental associations. So I've been doing teaching quite heavily for the past 13 years now. When the online education or the online world took off, I noted that instead of talking to 1,000 dentists a year through my courses, I can talk to 100,000 dentists every year. And the reach grew, and I have now a big following on Facebook and other social media and privately through my SurgicalMaster community. And in terms of credibility, just my academic credentials, but really academic credentials don't, are not that unique at the moment. It's more the ability to take surgical education and teach a doctor who is in a different continent, a different time zone, and really see the results. I have emails, and I will share some with you, where doctors are telling me that in a 15-minute video, they learned more than what they learned in a full A to Z implant program.
Right.
And I'm not saying that 15 minutes are enough, but I think why people gravitated towards these videos is that I just break down the process. I try to simplify it if it's simple, and I try to point out where are the pitfalls. And then doctors basically follow the formula. And wherever it's more technique sensitive or problematic, then I point out to that as well. So it's a knowledge base that builds up gradually and eventually leads to dentists performing surgery in their practice.
Yeah, I mean, you and I have talked before, so I'm familiar with all your stuff. But one of the things that I love is I go out and kind of what I do with practicingdentist.com is find resources for general dentists. I'm a huge advocate for general dentists, and especially young general dentists, 0 to 10 or 12 years out. And so I think what you're doing is awesome. And that's why I keep posting your stuff, because it's like you said, you are doing something unique in that you are making concise training material, not 2 hour long plane ride and show up at a hotel, and you're taking a 2 week long travel CE course and putting it into an hour or two, just because it's concise and it's compact. And I think people can view it all over the world, all over the country online, and using technology nowadays is the way it should be done. So I love it. And
It's simple.
it's simple. And I would love the way you break it down. So one of the things I think I'll post too with this interview is your Money Tooth book, because that is an awesome resource. Right?
Thank you. Well, it all comes from a need, an actual need. I believe, we all have a degree that is either DMD or DDS, okay, Doctor of Dental Surgery. That means that we are qualified, we are trained. We should be able to perform surgery, but the reality is, once you graduate from dental school, if you extracted 1 or 2 molars, you're lucky. So the reality is the first lower molar that I call the money tooth is the most commonly replaced tooth in dentistry. So I believe every dentist, wherever they practice in the world, should be able to extract the money tooth, graft the site, and replace with an implant. And I don't see a lot of dentists doing that. Right. So that's why I wrote this very quick guide, ebook, how to extract the money tooth and create a great implant site, where I just lay out the protocol that I use in my own practice. And if you follow it to the T, probably 8 out of 10, you'll be able to simplify the extraction process. And I try all my teachings to be just very, very practical
and concise. Yeah, I think, and I think you mentioned this to me before. I mean, the crown lengthening video, or this launch that you're doing for surgical training, it being crown lengthening, you're doing that for a specific reason, right? I mean, same with the money tooth. The reason why I love that training and that ebook especially is, like, you take all these concepts and you put it into one example, because there's so many concepts that are taught in that one extraction, right? And I think that's what you were saying with the crown lengthening. It allows you, it's not necessarily just that dentists are going to learn crown lengthening, they're going to learn all the basic concepts, or many basic concepts, of surgery in general, right?
Yeah, I mean, crown lengthening is a really broad term, and it's a very basic periodontal procedure that is done for either aesthetic or functional reasons. But this is my experience. When a dentist that has no surgical experience whatsoever, very little of it, and is trying to attempt a complex extraction or trying to get into dental implant, the surgical aspect of dental implant and grafting and things like that, and they're having a lot of difficulties, I found out that it stems from very basic things that they're lacking, like making incisions and designing flaps and right. Suturing and all the basics of surgery. So what a great way to start. A great way to start is to take crown lengthening, and yes, you'll be able to perform it, you'll be able to offer it to your patients, but all of a sudden you notice that you're getting better with other surgical procedures.
Right.
The procedures that you talk about in your own courses, and I followed your webinars as well. Okay, right. So I really enjoy watching them and actually learned a couple of tricks. So nice. So I do. I learn all the time. So I think general dentists are in such a great position if they can tap into sources of knowledge, because Cole, what's happening out there, and I'm in the education world for many years, there is conflicting information, there is confusing information. And what happens if you listen to too many speakers, too many teachers, you get confused and you end up not doing anything. So what I suggest is, you need the knowledge, but you need to learn systems. You need to learn the basics of surgery, so when a case comes into your practice, you don't get confused. And that's why mentoring is so important, because you have always somebody to talk to.
Right. I mean, that's, I think, the biggest fear that I've found with myself or general dentists that I've interviewed, from jumping in and stretching our skills and learning and kind of going out on a limb to push ourselves, is that fear of screwing up and being alone, or not knowing what I don't know. So having a mentor or someone to come alongside and at least, point out in your courses, hey, here are the top 10 things to look out for, the top most common mistakes. And then to go to someone and say, hey, I'm working on this course, here's my actual photo, and have a mentor actually look at it and give you some feedback is huge. I actually had to go out, when I started doing Invisalign, I had to go out and I would actually go to those, how Invisalign would always host those, like little local events where they maybe bring in a speaker for 10 or 15 dentists, and I would actually corner them and make them give me their email so that I could email so that
you can harass them.
so that
you
I could harass them.
later.
And there's still a couple of guys that they're so generous, and I feel so bad because I know that they did not do that lecture so that they could, sign up and answer all my case questions.
Sure.
But I still email them. So to have a course like yours where you're actually offering it as part of the deal is huge. So I think for surgery, it's going to take away a huge part of the fear factor.
Yeah. Well, fear is a total normal human emotion, and it's totally normal if there's something that you don't know, to be fearful and concerned, especially in our society that is relatively litigious in the United States here, especially where, depending where you practice, but, I practice in Beverly Hills, very high aesthetic demands, a lot of picky patients, as we call them. But this is what I found out very, very interesting. The number one quality, and let me ask you, the number one quality patients are looking for in their doctor. There are about 7 qualities. Are you empathetic? Are you, you present yourself well? Are you nice to them? The number one quality patients are looking for in their doctor is confidence.
Right.
Confidence. So if you're lacking the confidence, not only everything looks scary and you're not performing well, your patients are seeing that too. So all of a sudden, if you don't have enough confidence, you have problems with case acceptance.
Right.
So these things can be changed. You can train your confidence almost like a muscle. Going to the gym and growing muscles, if you do it the right way, you can do that. It's very similar to confidence, and it cannot be fake. It has to be real. And I found out that if you have the knowledge and you learn the skills, not enough. You get somebody to mentor you. It can be me, it can be somebody else, but it has to be a person that has enough experience, who has seen it all, who has been in the trenches, and is a real live clinician that depends on practicing. Because if you learn from an academician, nothing wrong with academia. I love academia. It's not for me as a career choice. But if you learn from an academician, they don't really do it in the real world,
right?
In real life settings. So I think I have a lot to offer in that sense. Now, the way this mentoring works, it's very organized. We created dedicated platforms, whether it's the private Facebook group or inside the course platform. But we also have a system to schedule doctors for their one-on-one. So all they need to do once they get to it, they'll have access to my schedule. They'll see when I have slots, and they can book themselves. And the system works very similar, like we're doing now over the phone, but it'll be a one-on-one where we can share a screen, we can exchange views, I can give them some advice. But mostly because I worked with so many thousands of dentists over the past 13, 14 years, I know what the problems are. Mm-hmm. The number one problem is confidence. The number one problem is actually knowing too much, getting overwhelmed. And all I do is like building Legos. You start from the bottom, the bottom bricks, and you start following the instructions. That's what I try to do with dentists. So if a dentist calls me and he says, I'd like to learn how to do sinus lifts, and I'd like to do a ridge augmentation, the first thing I'll ask them, how many extractions do you do? What's your experience with extraction? How are you with periodontal surgery, with flaps and harvesting tissue? And if they tell me I don't do any of that, then we start with the basics, because you want to set yourself up for success. And why get into trouble when you can do it gradually and you can be much more successful? I also teach them what not to do. What cases are just don't touch them. Just either refer them or just offer an alternative.
Right. No, that's awesome. I love it, Ziv. I think this can be so helpful, and I'm excited to see this launch, which is coming out in a couple days. Is it tomorrow? When is the this main launch?
You know,
how do we invite people to join?
This is what we did. You see, we have a list of doctors that we call it a waiting list for the crown lengthening course, and we had about 1,000 people on the list already. And we already offered the program to them. So we have already a lot of doctors joining us, but the official launch is on Thursday, December 1st. So the way this is going to work, and I'm so excited about it, Cole. We worked so hard on that. I want to make sure that when I launch this program, there are going to be a lot of videos, a lot of training opportunities, and other resources that I'm going to offer as part of the launch. Whether you join or not, it doesn't matter, because every video has something valuable that you can apply in your practice, that you can utilize to better yourself, to know more, to do more surgery, even if you end up not joining the course. But I wanted to make sure that once we have this process going, that everybody can get something out of it. So basically the way it's going to start, I'm going to send an email to the doctors on the list, and basically the easiest way to join is to go to SurgicalMaster.com, and you end up on a landing page where you can fill out your name and your email, and you're getting some sort of handout. I think it's about lip repositioning. That's what we have up there at the moment. And then you'll get an email December 1st, which is this Thursday, inviting you to a free training on crown lengthening in 3 parts. And basically every couple days you'll get another video about crown lengthening, and I'll talk about different angles, I'll talk about different options, and at the end of this training series, you'll be able to join the course if you wish. But if you don't, that's totally fine if you're not ready, but you'll still learn something about crown lengthening. Now, I'll also have a few webinars. As part of it, I'll have some written resources, some checklists that I'm going to offer, and other videos and training, and it's all going to be great. It's going to be a lot of fun.
Yeah, that's awesome, Ziv. I think, I'm going to put a post link up for that too. But well, thanks so much. I think you're a busy guy and you have a ton going on. But I'm going to share this, and we'll definitely keep an eye on you, because you're helping a ton of general dentists by offering something no one's doing. So I think it's great. So thank you so much, and we'll have you back on soon.
Thank you, Cole. I appreciate it, and keep up all the great work. A lot of the young dentists need somebody like you that can start them off the right way, to offer them all the good resources, some of them as part of my platform. But I noted that you're doing a lot of things with oral surgery and endodontics, and also, and mostly practice management. I watch your videos. I enjoy watching them and learning from them. You have great presence, and you have great message and great information. And I did not have that graduating almost 17 years ago. I had to figure these things out by myself. So I think you and I together, we can take a lot of the dentists that need the help, that want to have more confidence, that are interested to grow, have a great practice, great comfortable lifestyle. And really, it's about enjoying dentistry. I'm finding a lot of dentists are discouraged by dentistry. They're working in the wrong practices. They're working in HMOs and those not great offices to be in. I want the dentists to be the ones that love dentistry like we do,
right,
that enjoy going to work. And really, if you don't enjoy what you're doing, then you got to find something else.
Right.
Okay, and one of the things we'll offer is how to excel in surgery. It's a wonderful thing to get into. So the love goes back to you, Cole. Okay, thank you for all that you're doing, and I look forward to talking to you again.
Hey, thanks a lot, Ziv. All right, everyone, that concludes our interview with Ziv Simon, the founder of SurgicalMaster, an awesome online resource for dentists who want to learn and expand their skills in advanced surgical training. So check out his website. I'm also going to post his link to the free guidebook called Money Book. It's awesome. Money Tooth. It's awesome. And it breaks down step by step how to take out a lower first molar, what mistakes most dentists make, and what things to look out for, what difficulty creating factors exist out there. So check that out. Also, if you're interested in coaching and building your own practice, check out my Dental CEO program. It's awesome. It's a one-on-one coaching program where I walk you through step-by-step how to build and grow and launch your own practice. So don't go at it alone. Avoid the mistakes. The money you're going to save going through the coaching, I believe, more than pays for itself. So check it out, www.practicingdentist.com.